So I have the man of the hour with me, Dr. Ladd, as we're driving around north central Indiana, and I wanted to ask him and pick his brain a little bit. Dr. Rick Workman, the founder of Heartland, at the last ADSO meeting, was talking about how in his opinion, he thinks up to 50% of the dental offices in the marketplace today are unsellable. So his kind of expectation was, if you're doing less than $500,000 in collections or gross revenue in working out of a house or a very outdated facility, there's really not much there in terms of what another group or entity or provider could find value in. So I wanted to ask Dr. Ladd what his opinion was in perspective on dentists in the second half of their career. What is the best thing that they can do in terms of positioning their office for that transition and making sure their patients continue to get the care that they need, and the dentist truly has the opportunity to, what we talk about some, is retiring in practice. So I wanted to pick Dr. Ladd's brain and see how he was able to do it here at Ladd Dental Group and what his perspective is on that topic. So Dr. Ladd, hearing that question, what is your thought that dentists second half of their career, best way to position their office so their patients continue to get the care that they deserve?
Number one, increase your capacity. If you can't see more patients today than you're already seeing, you must increase the capacity.
Yep.
Expand that. Training is the next most important thing. Training for yourself and your staff. It's not necessarily providing more services, types of services, but focusing on what you really do well and do a great job.
Yep.
Then I believe to have up-to-date equipment.
Yep.
That does not mean buying every trinket that comes along the line.
True.
We don't all need to have the ability to do a crown in the office. Using a scanner, though, is a very good way to improve your quality
Yep.
and capacity.
Yep.
Those are the main things you must do.
Yep.
If you don't, the other thing I think is a standalone facility.
Mm-hmm.
You're lost if you're in a strip mall. You're lost if you're in an old house.
Yep.
Or in a building where there are multi-dentists.
True.
Or physicians. You need to be where people can see you and you're very visible.
True.
Those are the main things.
Awesome. Well, thank you for that, and we'll have more videos to come on that. I can't agree more with that philosophy. And in particular, some of the things that will retain their value is good equipment. Good equipment does come with value, and a good office location has a lot of value there. Location still matters. And see our previous video talking about our Wabash office and what that new location did for us there. So stay tuned for more, but I wanted to pick the big man's brain, and stay tuned as well with a lot more content to follow.